Do you have aches, pain, or tension in your head? Does it vary in how long it lasts, or is it always the same? Do they happen at different times of the day? These type of headaches are actually different than a migraine, which is a head pain of at least moderate severity, usually on one side of the head, and occurring with other symptoms such as nausea, vomiting, sensitivity to light and noise, though some people experience migraine without the headache. The International Headache Society has two broad categories for headache disorders. The first is based on symptoms, called primary headache disorders, and includes migraines, tension-type headaches, and cluster headaches. Now, the second is a little bit more serious. It's based on their causes, called secondary headache disorders. This would include headaches associated with injury, stroke, substance misuse and/or withdrawal, including alcohol, infection, disorders of the neck, eyes, nose, sinuses, or teeth. It's actually important to understand the type because we can help you determine which doctor to see. So the first we often see in our office, but the second type, it's not up our alley at all, and we'd suggest calling 911 or talking directly with your medical doctor. See, learning to live with pain is one of the biggest health problems in our country because your health affects everybody around you. Now remember, success loves action, so if you agree with me that getting help is better than dealing with a worse problem later, here's some tips that I think can help you. According to the American Medical Association, after establishing a migraine diagnosis, management should include avoidance of potential triggers and risk factors, if identifiable, including avoidance of excessive caffeine intake, lifestyle modification that includes regular exercise, regular sleep, and wake schedules. Also remember that regular meals are important. In fact, I have some patients who use food diaries to determine which foods trigger them at which times a day. I found some patients do better by hydrating with more than at least 8 glasses of water a day. Some of my patients have improved just by getting their eyes checked by their eye doctor to reduce eye strain. Now, since every case is different, I'm not going to pretend that I can give all the solutions over one video. So if none of these work, maybe it's time to come see us in our office. We do consultations just to see if we can help, and since we likely agree that your pain affects others in your life, now's the time. We practice NUCCA Chiropractic. It's a gentle, non-manipulative form of chiropractic which relies on a very, very detailed workup. We do it over a 2-day period of time, an extensive exam, very, very focused x-rays, and a precise, gentle adjustment. And remember, if I can't help you, I'll let you know that too. We also use cold laser therapy. I've found it's helpful to help reduce pain. Also to increase circulation. Remember, there's joints in your body that don't get a lot of circulation. That's why they never heal. Additionally, our docs can bring the knowledge to you. We speak to local community groups and businesses regularly on the topics of reducing stress, which, quite frankly, stress is like America's national pastime now, better sleep, which poor sleep is also something very common, more energy, greater productivity, both at work and home. Our office is warm and friendly, and we do everything we can to help you feel at home. So call Lynn, Michelle, or call me today. We can help.